Every single night, across the country, tens of millions of people do the exact same thing. They wake up, throw back the covers, and walk to the bathroom in the dark. Not once. Sometimes 2, 3, even 5 times before sunrise. And here is something almost nobody hears from their own doctor. In roughly 8 out of 10 of these cases, the bladder itself is completely healthy. It was never the problem to begin with. All those pills, supplements, and herbal blends you've been taking for your prostate or your bladder, they're aimed at the wrong organ entirely. If that surprises you, stay with me, because by the end of this video, you'll understand exactly what's actually happening inside your body, and more importantly, what to do about it tonight. Picture this. It's 3 in the morning. The house is silent. You finally sank into that deep, heavy sleep, the kind that actually restores you. And then it arrives, faint at first, just at the edge of awareness. You try to ignore it. You try to think about something else. But the pressure keeps building until you have no choice. You throw off the blanket, plant your feet on the cold floor, and shuffle to the bathroom half asleep, squinting against the light. You finish, you climb back into bed, and sleep is gone. Your mind starts running through everything: work, bills, family. An hour passes before you drift off again, and then it happens a second time. By morning, you feel wrecked, foggy, heavy-headed, and you spend the entire day running on caffeine just to function normally. I have watched this exact exhaustion in the eyes of hundreds of patients sitting across from me in my office, and almost every single one says the same sentence: "Doc, what can I do? It's just my age." Everybody gets up at night eventually. I need to be completely honest with you right now. That sentence is a myth, and it's a dangerous one, because it stops people from looking for the real cause. Getting up repeatedly at night to urinate is not a normal, expected part of aging. Not at 40, not at 50, not even at 70. A properly functioning body is built to prevent exactly this. While you sleep, your brain releases a specific hormone called antidiuretic hormone, also known as vasopressin. Think of it as a nighttime memo sent directly to your kidneys. Slow down. Switch to night mode. Concentrate the urine. Reduce the volume. Run on minimal output until morning. That single mechanism is what allows a healthy person to sleep 7 or 8 hours straight without a single interruption. When that system breaks down, it isn't a minor annoyance you should just accept. In medical terms, this condition has a name: Nocturia, which simply means waking repeatedly during the night to urinate, and it qualifies as an actual diagnosis. If you're getting up once a night, consider that your first warning light. If you're getting up 2 or more times, that's an alarm actively going off, because every time you wake, your heart rate jumps, your blood pressure spikes, and you get yanked out of deep sleep, the exact phase where your brain clears out waste products, your neurons repair themselves, and your cardiovascular system genuinely rests. Lose that phase night after night for years, and you're looking at a fast track toward high blood pressure, depression, and accelerated brain aging. Published clinical research has actually shown that chronic nocturia places more stress on your cardiovascular system than long-term smoking does. That isn't an exaggeration for effect. That's documented data. Now here's the piece I really want you to absorb, because it changes everything. When patients walk into my clinic with this exact complaint, the overwhelming majority have already diagnosed themselves before they even sit down. Men tell me, "Doctor, it's obviously my prostate." Women tell me it must be menopause, or a prolapse, or a recurring bladder infection. They've already tried diuretic herbal teas. They've taken rounds of antibiotics they probably didn't need. They've bought every advertised urinary health supplement on the shelf. Some have gone so far as restricting their water intake so aggressively that their mouth is bone dry by dinner time. They stop drinking liquids after 6 in the evening. They go to bed thirsty, and they still wake up at 3 in the morning needing to go. Why does none of it work? Because they're fighting a symptom instead of finding the actual source. Let me give you a simple way to picture this. Imagine your smoke alarm goes off in the middle of the night. Most people's instinct, frustrated and half asleep, is to rip the batteries out or tape over the sensor so the noise stops. But that doesn't put out the fire. It just silences the warning while the real problem keeps burning somewhere out of sight. That is exactly the mistake most people make with their nighttime bathroom trips. Your bladder is the sensor. It's simply signaling that something else, somewhere else in your body, needs attention. And in roughly 80% of cases, the bladder itself is functioning exactly as designed. It's just emptying out whatever has been delivered to it. The actual malfunction isn't the container. It's what's filling that container overnight, and why. The answer might genuinely surprise you, because the real culprits, in the vast majority of cases, are your legs and your heart, not your bladder, not your prostate. But before we go further into that mechanism, I want to pause as a physician with 15 years of clinical experience and flag something important. There are specific warning signs that should send you straight to a doctor's office, not to a video like this one. First, blood in your urine without any accompanying pain. If there's pain alongside blood, that combination usually points to something like a kidney stone or an acute infection. Miserable, but rarely an emergency. But dark red or brown urine or visible clots with no pain at all is one of the earlier warning signs associated with bladder cancer, and in anyone over 50, that finding warrants a direct conversation with a urologist and likely a cystoscopy, a procedure where a camera examines the inside of the bladder. Don't wait on that one. Second, unexplained bone pain combined with sudden, significant weight loss, 10 to 20 pounds over a couple of months with no diet change, paired with nighttime urinary symptoms, is also something that needs a doctor's evaluation, not home remedies. If none of those red flags apply to you, you can exhale. You're going to be fine. And the rest of this matters because the quality of your sleep, and frankly, the quality of your daily life, is absolutely worth protecting. To protect it properly, we need to understand exactly which type of malfunction is actually happening inside your particular system. In urology, nighttime urinary problems generally split into 3 completely different categories. The treatment for each one is different, and what helps one type can actually make a different type worse, which is exactly why guessing at the cause and self-treating so often backfires. Type 1 is global polyuria, meaning your body is simply producing too much urine overall, around the clock. You're going frequently both day and night, and each time the volume is substantial. If you measured everything you produced over a full 24 hours, you'd likely land somewhere around 3 to 4 liters. There are usually 2 explanations behind this. First, you might simply be drinking enormous volumes of fluid throughout the day, carrying a water bottle everywhere under the belief that more water is always better. The physics here is straightforward. Whatever goes in eventually has to come out. The second possible cause is diabetes, either type 2 diabetes, where excess glucose pulls water along with it into the urine, or a less common condition called central diabetes insipidus, involving a hormonal disruption originating in the brain. Urine in this category tends to be pale and nearly odorless, and the frequency is roughly equal between day and night. This pattern calls for an endocrinologist and a blood sugar evaluation, not a urologist. Type 2 is nocturnal polyuria, and this is the sneaky one, the type found in roughly 60 to 70% of people over 50. The pattern looks like this. During the day, everything seems completely normal. You go about your routine, run errands, use the bathroom every 4 or 5 hours, nothing burns, nothing hurts. But the second you lie down for the night, everything changes. 3 or 4 trips, each one a genuinely full bladder, large volume every time. In the morning, you're left scratching your head because you only had half a glass of something with dinner. So where did over a liter of fluid come from overnight? This is the textbook picture of nocturnal polyuria. Your kidneys have essentially flipped their schedule, running at reduced capacity during the day and ramping up to double or triple output once you're horizontal. We'll get into exactly why that happens in a moment, but the critical takeaway right now is this. If this is your pattern, your bladder has nothing to do with the underlying cause. Treating the bladder directly is a complete waste of effort. Type 3 is a reservoir problem, and it looks almost the opposite. The urges here are sudden, frequent, and intensely urgent. You feel like you genuinely won't make it in time. You rush to the bathroom, sit down, and almost nothing comes out, maybe a few drops. 40 minutes later, the same emergency hits again, and again, barely anything is released. In this scenario, the bladder itself is the actual source of the problem. It's either lost its ability to stretch to a normal working capacity, or its nerve signaling has become oversensitive, triggering the urge at a mere 50 milliliters when normal capacity before signaling urgency should sit somewhere around 200 to 300 milliliters. This pattern shows up with benign prostate enlargement in men, overactive bladder in women, chronic low-grade bladder infections, or bladder and ureteral stones. So to lock that distinction into memory, frequent and high volume both day and night points to global polyuria. Completely normal during the day, but flooding overnight points to nocturnal polyuria. Urgent, frequent signals with barely any actual output points to a genuine reservoir problem. Take a moment and think about which pattern actually matches what you're experiencing. because everything from here forward depends on getting that classification right. Let me walk you through a real patient I treated, someone I'll refer to as Anthony. 54 years old, the kind of solid, self-reliant man who almost never sees a doctor unless he's truly desperate. And by the time he sat in my office, he was desperate. He came in carrying a thick folder, a bladder ultrasound, his PSA blood work, that's the standard prostate cancer marker, and a stack of prescriptions he'd accumulated. He told me immediately, "It has to be my prostate, or God forbid something worse. Please just fix this. I can't keep living like this." He laid out the timeline for me. It started as 1 bathroom trip a night, easy to dismiss. Then it became 2, then 3. For the previous 6 months, he'd been getting up 4 or 5 times nightly. Try to imagine that kind of torture, finally falling into real sleep and then being yanked back out of it, over and over, every single night for half a year. Anthony had done exactly what advertising and internet forums tend to push people toward. Since the symptoms showed up as frequent urination, he assumed his prostate had to be guilty. He bought the marketed supplements. He tried suppositories and herbal blends from the pharmacy. Then he reasoned, logically enough on the surface, that if his body was producing so much urine, the obvious solution was to drink less. So he imposed a strict evening fluid restriction on himself. And he still woke at 2 in the morning and released roughly half a liter. He woke again at 4 and released another half liter. Where was all of that coming from when he hadn't had a drop to drink in hours? When he finally sat in front of me, eyes red from months of fragmented sleep, I reviewed his lab results carefully. His PSA, the prostate marker everyone fixates on, came back completely normal. He had a mild, early-stage prostate enlargement, technically present but nowhere near significant enough to cause this kind of nightly pattern. His bladder scan showed no stones, nothing structurally wrong. From a strict urological standpoint, this man was nearly textbook healthy, and yet he wasn't sleeping, and he was genuinely suffering because of it. So I stopped asking about his urinary habits entirely and started asking about how he actually lived day to day. "Any shortness of breath?" I asked. "A little, I guess," he said. "If I climb to the 3rd floor, I have to stop and catch my breath. But I smoked for 20 years, only quit about a year ago, so I figured that explained it. Does your ring feel tighter by evening? Does the elastic of your socks leave a groove on your skin?" "Yes, actually," he said. "When I take my socks off at night, there's a real indentation in the skin. But doesn't everyone get that?" And right there, the entire picture clicked into focus for me. I told him something that genuinely stunned him. "Anthony, throw away the prostate supplements. You don't need a urologist right now. I'm sending you to a cardiologist and a sleep specialist instead." He looked at me like I had completely lost my mind. What does my heart have to do with this? I'm running to the bathroom, not clutching my chest. But he trusted the process and went. Here's what those specialists found. The cardiologist identified early-stage heart failure, a quiet, undramatic version with none of the chest-clutching symptoms people associate with the term. During the day, Anthony's heart was already working close to its limit. It couldn't fully circulate his blood volume efficiently, so fluid was pooling in his body tissues, primarily down in his legs. And the sleep specialist diagnosed obstructive sleep apnea, repeated brief pauses in breathing throughout the night. He'd snore, stop breathing momentarily, then startle awake with a gasp, usually without remembering any of it. Sleep apnea on its own disrupts the production of antidiuretic hormone and forces the kidneys into more active overnight filtration. So when Anthony had been swallowing prostate supplements every evening, he was essentially trying to patch a leaking faucet while a pipe had burst in the basement below him. Let me walk you through the actual physics of what was happening inside his body, because this same mechanism is playing out in the majority of people watching this right now. Picture a plastic bottle half filled with water. Standing it upright, the water settles to the bottom. Lay it on its side, and the water redistributes evenly. Your circulatory system behaves the same way. For roughly 16 hours a day, you're vertical, standing or sitting, and gravity is constantly pulling blood, lymphatic fluid, and the fluid between your cells downward toward your feet and ankles. In younger, healthier vessels, the veins act like strong, elastic tubing, and tiny one-way valves inside hold blood firmly in place, preventing it from pooling below. The muscles in your legs, every time you walk, contract rhythmically and act as a secondary pump, pushing blood back upward against gravity. But with age, or with a largely sedentary lifestyle, this entire mechanism weakens. Veins stretch out, Valves begin leaking, and the muscular pump effectively shuts off because you're sitting at a desk or on a couch for hours at a stretch. Fluid starts seeping outward through the vessel walls into the surrounding soft tissue. Inside the loose connective tissue of your lower legs, up to 1.5 liters of water can quietly accumulate without you ever noticing anything beyond a slight sock groove. 1.5 liters. That's roughly 3 large mugs of fluid sitting silently in your tissue. And here's the key detail. Your kidneys never see that water. It's effectively switched out of active circulation because kidneys only filter what's actually moving through the bloodstream at any given moment. Now picture the evening unfolding. Anthony gets home from work, eats a large dinner, often something salty, a pickle, some cured meat, a spoonful of mayonnaise, and settles in front of the television. From around 7 until 11 at night, 4 straight hours, his legs hang downward. Gravity keeps doing its work, and fluid keeps quietly accumulating in his calf tissue. His heart rate is slow and steady, low pulse, because he's simply sitting still. Then he turns off the television and lies down for bed. This is the exact moment everything shifts. His legs rise to the same horizontal level as his kidneys and heart. Gravity no longer holds that accumulated fluid down in his lower legs. All of that water, gathered over 12 hours inside the sponge-like tissue of his calves, begins rapidly flowing back into general circulation. It gets reabsorbed into his veins and surges in a powerful wave toward the center of his body. His total circulating blood volume rises sharply and suddenly. Imagine someone injected an extra full liter of fluid directly into your bloodstream within a single hour. That isn't a metaphor for effect. That is essentially, physiologically, what happens every night to anyone carrying hidden fluid retention in their legs. And at precisely this moment, the real conductor of this nighttime process steps onto the stage, and it's your heart. Specifically, a small but extraordinarily powerful hormone called atrial natriuretic peptide, or ANP. This is genuinely the central mechanism behind this entire phenomenon, so stay with me here. As the returning fluid from the legs reaches the heart, the right atrium begins filling and stretching beyond its typical resting volume. Your heart senses that the system is becoming overloaded and that internal pressure is climbing. In response, it releases ANP directly into the bloodstream, essentially a chemical telegram sent straight to the kidneys. The message is short and urgent. Dump this excess fluid immediately, or I risk being overwhelmed. This hormone actively blocks aldosterone, the hormone normally responsible for retaining water in the body, and your kidneys shift into an accelerated emergency filtration mode, expelling water and sodium rapidly to relieve pressure on the heart. The outcome becomes entirely predictable. Within roughly an hour of lying down, your bladder is genuinely full. You wake, walk to the bathroom, come back to bed. But the fluid mobilizing out of your legs isn't finished yet. The process continues steadily through the night. 2 hours later, your bladder is full again. The cycle repeats itself until morning arrives. This is precisely why Anthony, who hadn't had a single sip of water since 6 in the evening, was still running to the bathroom relentlessly all night long. He was, quite literally, drinking through his own legs. His legs had stored up roughly 1.5 liters of fluid throughout the day, and overnight, every bit of it funneled directly through his kidneys. No prostate supplement on earth, no herbal remedy could ever stop that process, because every single one of those interventions was targeting an organ that had nothing to do with the actual problem. Treating your bladder with pills when the actual cause lives in your heart and your legs is the medical equivalent of taping over a smoke alarm while a fire keeps burning out of sight. Your body is trying to protect itself, and you're inadvertently fighting that protection. So how do you check whether this exact mechanism is happening to you? No MRI required, no expensive lab panel. Just your own 2 hands and a few quiet minutes. Test 1, locating hidden fluid. Sit down comfortably and expose the lower section of one leg, between your knee and ankle. Find your shin bone, the hard surface running along the front of your lower leg with no muscle covering it. Press the pad of your thumb firmly against that bone, about 4 to 6 inches above your ankle, and hold for 10 to 15 seconds. Release, then run a finger across that same spot. If your skin springs back immediately, smooth and flat, there's no significant fluid buildup. But if your thumb leaves behind a visible, lingering dent that takes several seconds to fill back in, you've just located a hidden reservoir of trapped fluid. Even if your leg doesn't look swollen from the outside, that pit is solid evidence your tissue is saturated with water, and at night, all of it is going to move straight through your kidneys. Test 2, a simplified urine diary. Pick a day off and do some basic measurements. Grab any container with volume markings. Even a measuring cup works fine. Track your urine output separately for daytime and nighttime, including that very first trip immediately after waking in the morning, since that one technically counts as overnight output. Add everything up. If your nighttime output exceeds roughly a third of your total daily volume, that's officially classified as nocturnal polyuria. As a simple example, if you produce 1,500 milliliters across 24 hours and 500 milliliters or more of that happened overnight, you're looking at exactly this pattern. Your kidneys have inverted their normal schedule because of fluid retention or a hormonal shift, not because of anything actually wrong with your bladder or your prostate. If both tests come back positive, meaning the pit in your leg lingers and your nighttime urine is pale and abundant, you can genuinely relax. Your bladder is almost certainly fine. You don't need surgery, expensive procedures, or a lifetime of prescriptions. What you need is to work on your circulation and adjust your daily routine, and that's exactly what we cover next. You might be wondering whether diet plays into this as well, and the answer is yes, in ways that may genuinely surprise you. Certain foods act like a delayed switch on your kidneys, quietly programming them to do most of their heavy lifting overnight, and you're probably eating these foods at dinner believing they're harmless. When I ask patients about their evening meals, most insist they're careful. No pickled herring, no obviously salty snacks. Then it turns out dinner was a sandwich with cheese and cured meat, or crackers with cream cheese before bed. Here's something worth remembering. Roughly 80% of the sodium most people consume doesn't come from a shaker at all. It comes from packaged and processed food. Cheese, cured meats, mayonnaise, canned goods, bread. 100 grams of ordinary hard cheese can contain as much sodium as an entire bag of potato chips, and you simply don't taste that sharpness because fat and flavor compounds mask it completely. Here's the overnight mechanism. You eat a cheese sandwich at 7 in the evening, sodium enters your bloodstream, and your body immediately reacts by retaining water to dilute the excess concentration. In the evening, that holding pattern keeps you from feeling the urge. The salt is locking water inside your vessels and tissues. But overnight, your kidneys detect the accumulated sodium load and begin actively flushing it out, and sodium pulls water along with it as it leaves. To eliminate just 1 gram of excess sodium, your kidneys have to push a meaningful volume of fluid through the system. The result is that you wake up at 2 in the morning, not because you drank too much water, but because you're eliminating last night's cheese. The second hidden trigger is evening sugar. A cookie, a small dessert, even a piece of fruit before bed seems harmless, even healthy. But simple carbohydrates in the evening trigger a rapid blood sugar spike, your pancreas releases a burst of insulin, and insulin signals your kidneys to initially retain sodium and water. Then, 2 to 3 hours later, right around when you've actually fallen asleep, blood sugar drops sharply, triggering a rebound where your kidneys switch into active fluid excretion. If you also carry even mild insulin resistance, extremely common after 40 and often symptomless, elevated blood sugar itself acts as an osmotic diuretic, pulling water directly into the urine. You essentially create a homemade water pill just by eating a slice of melon before bed. The third overlooked factor is alcohol. Many patients tell me a nightcap helps them sleep more soundly, and they're not wrong about the sedative effect. But alcohol is also one of the most powerful blockers of antidiuretic hormone, the same nighttime hormone we discussed earlier that tells your kidneys to slow down and concentrate urine. Alcohol cancels that signal entirely, so your kidneys run at full, unrestricted filtration speed all night. You might sleep through the first urge thanks to the sedation, but the bladder keeps filling until the second urge becomes impossible to ignore, and your overall sleep quality that night is far worse than if you'd skipped the drink entirely. Now let's talk about foods that genuinely help. Raw, unsalted pumpkin seeds top the list, rich in highly absorbable zinc and magnesium, which relax the muscular wall of the bladder and allow it to comfortably hold more volume before signaling urgency. A small, daily handful is one of the cheapest, most effective habits you can build. Real cranberries, not sugary juice cocktails, contain compounds that prevent bacteria from clinging to the bladder lining, calming chronic low-grade irritation that makes the bladder oversensitive. And adequate fiber matters too, purely mechanically, since a chronically bloated colon presses directly against the bladder, making it signal fullness long before it's actually full. For Anthony, the real turning point wasn't diet alone. It was a simple daily routine. Each morning, 30 gentle heel raises to reactivate sluggish leg vein valves. Throughout the day, shifting most fluid intake earlier, aiming for roughly 70% before 4 in the afternoon. And critically, about an hour before bed, lying down with his legs elevated above heart level for 15 to 20 minutes, allowing trapped leg fluid to safely redistribute and pass through his kidneys while he was still awake and in control, followed by a final bathroom trip before sleep. He added gentle, correctly performed pelvic floor exercises in bed as well. Within 1 week, he went from 5 nighttime trips to 1. Within a month, he was sleeping through most nights entirely, and his cardiologist confirmed his leg swelling had measurably improved alongside it. This works because it's built on real physiology, not wishful thinking, and it requires nothing beyond consistency. Your bladder was never your enemy here. It was simply the messenger. Once you address what's actually filling it overnight, instead of silencing the alarm itself, real, lasting sleep becomes possible again.